Good morning, dear student. Today we are going to study hospital formulary. It is a part of any hospital. Hospital formulary is nothing but a list of medicine which is keeping in hospital. Now, we can see the definition of hospital pharmacy. The hospital formulary is a list of pharmaceutical agents with its important informations which reflect the current clinical views of medical staff. These pharmaceutical agents, they includes pharmaceutical medicines, surgical devices, um, and uh, devices which are used in the OT operation theater, and chemical which are used in biochemistry or in pathology laboratory, that also include in hospital formulary. The hospital formulary system is a method. This is an important chapter. You are getting 4-mark question in your university examination. One short note is there. The hospital formulary system is a method whereby the medical staff of a hospital, with the help of pharmacy and therapeutic committee, selects and evaluate medical agent and their dosage form, which are considered to be most useful in the patient care. The hospital formulary system provide the information for procuring, prescribing, dispensing, and administrating of drug under non-proprietary and proprietary brands name in instances where drug have both names. So hospital formulary is a very important uh, list or list of devices and list of pharmaceutical preparation medical devices that is commonly used, frequently used in a hospital. Then you must remember this thing. This in hospital formulary, a number of medicines, life-saving medicines are included. First time hospital pharmacy formulary word is used in 1968 in Department of CMC, Vellore. The first hospital formulary for a government teaching hospital in India was published in 1997 in Government Medical College, Trivandrum. This is a common list. This is a very useful list which are always available in a hospital. If some shortage is there, then we can overcome this shortage by the procuring of medicine or equipment on time. So these material which is included in a hospital formulary must be available or always be available in your hospital. Advantages of hospital formulary, that is therapeutic advantages, because all medicines available in a hospital at any time. Economic, when you are purchasing in a bulk, that is economic for you, or that is economic for hospital also. educational purpose, some new molecules, some new medicines are coming in a market, and you are including in hospital formulary. That is also good for your medical staff and pharmacy staff to get information regarding that particular new molecule. And rational drug use, that is also is common, which we are using commonly using drugs frequently last few years, or conventionally type drugs like paracetamol or ibuprofen, or very old brand name drug, well running drug that included in a hospital formulary. Now, disadvantage deprive the physician of his right and privilege to prescribe and obtain the brand name of his choice. Now, this system also having one disadvantage. Here, a physician is bound to write, or he is having some guideline, or he is having some idea about the hospital formulary, so he is not going for any new molecule. He is always prescribing that drugs which is included in hospital formulary. That is a disadvantage of this system. Now, it permits the pharmacist to act as the sole judge of which brand of drugs are to be purchased and dispensed. Here, there is no role of physician to to write a drugs other than hospital formulary. Only pharmacist, he is involved in a procurement process, and drug which is available in a hospital, physician going to prescribe that particular drug. So that is a disadvantage, but this disadvantage also overcome by the formation of one committee, that is PTC, Pharmaceutical Therapeutic Committee. That committee is decided which drugs is going to include in hospital formulary or not, or which drug is going to continue in this particular list. So, hospital formulary we have seen. Now, guideline for hospital formulary. The government body of the hospital should appoint a pharmacy and therapeutic committee. That is, I told you, PTC. PTC also a very important topic. I will tell you in third unit. This PTC is a one committee which decide the hospital formulary within a hospital, along with number of works which is going on in hospital, that is also regulated by the PTC. PTC is nothing but a committee which includes some physician, some pharmacists, and some nursing staff. Now, PTC shall sponsor and outline the purpose, organization, function, and scope of hospital formulary system. It should adopt the principle as per the need of particular hospital. This hospital formulary is always preparing to see the need of that particular hospital, which type of material frequently used in that particular hospital. PTC develop the policy and procedure. Medical staff adopt this subject to administrative approval. Administrative approval also required for the inclusion of drug or inclusion of uh, any material or medicine in for drug formulary. The policy and procedure shall be afford guidance in the appraisal, selection, procurement, storage, distribution, use, safety, and procedure and other matter relating to the drug in a hospital shall be published in a hospital formulary, other media available to the member of medical team. So these are the guideline of hospital formulary, uh, which going to prepare in hospital by the PTC. Uh, Hospital formulary is nothing but a list of drugs or pharmaceutical agents which is included in the list, and which is available, always available in a hospital to give the better service to the patient. So if any question come regarding the hospital formulary, you must answer or you must know what is hospital formulary. It is a list of medical devices or medical pharmaceutical substances which is always present in a hospital, which is prepared by the PTC, Pharmaceutical Therapeutic Committee. Now, next is prescribers should be strongly encouraged to prescribe drug by their non-proprietary names. Uh, so, physicians are advised to prescribe the medicine in its generic name, uh, rather than the brand name in that particular hospital. So easily drug can administer to the patient, which is available in a hospital. Now generic equivalent and therapeutic equivalent must be there. Now, pharmacist is responsible for the selecting from available generic equivalent. What is that? That is a prescriber prescribe the medicine to the patient. Then pharmacist must be responsible to give that particular medicine and equivalent strength of that medicine to the patient. Now that the prescriber has the option to specify the brand for the particular prescription. If a physician knows to mention the particular brand name in the prescription, then he can. Now, PTC is responsible for the determining those drug or product or, and entities. Now, for the next year planning, PTC can include that particular medicine also in hospital formulary. Now, medical and nursing staff are informed about the changes in hospital formulary system. If PTC make any changes in a hospital formulary system, then medical and nursing staff also must be available, must be known about that particular changes. Now, labeling of medicine with non-proprietary medicine followed by decided format. Now, to develop an effective formulary system, it is made up by PTC. PTC has to consult various references of drugs regarding pharmacokinetic profile, interaction, adverse drug reaction, and that particular information keep in mind and prepare the hospital formulary. Now, formulary content and organization. The primary objectives: information of drug, which drug which is available in a hospital, the information, entire information of that particular drug must be available in the pharmacy or in the literature which is available. Information of hospital policies and procedure. And next is special information about the drugs that must be included in the literature of that particular drug. In accordance with the objectives, the formularies should be consist of three main parts. Now, this is a part of formulary. Information of hospital policies and procedure concerning drugs which is available in a hospital. Now, second is drug product listing. That is a list of drugs which is available in a hospital pharmacy. Uh, in that list, life-saving drug must be included. Now, special information of, if any, that is also included in a hospital formulary. A hospital policies and procedure. In here also mention the drug use, description of PTC, Pharmaceutical Therapeutic Committee, hospital regulation about the prescribing, dispensing, administration of drugs, rules of medical emergencies, drug products, etc. Pharmacy operating procedures also mentioned, and information of using drug formulary, that also be mentioned in a literature. Now, drug product listing. Now, this is a formulary items entries. We are making the list as per alphabetically by generic name, alphabetically with therapeutic class, type of information. Uh, Here we must disclose the dosage form, strain, packaging, in which form it is available, what are the active ingredient of that particular drug, adult and pediatric dose of that particular drug, that is also mentioned, route of administration and cost of that particular drug, index of index to the drug products listing. That index is prepared alphabetically with generic name or brand name, therapeutic and pharmacological index. As you seen in your uh, cognosy book, that is available in chemical classification based, morphological classification based, therapeutical use based, just like our list also is prepared as per the generic name or brand name, therapeutic or pharmacological index based. Now, special information regarding formulary, equivalent dosage form of similar drug that's included in a same site. Now, hospital approved abbreviation also just like paracetamol, PCM or PCTM, just like we can write. That shows the we can write the abbreviation for particular drug. That abbreviation is running in that particular hospital, not entire scenario, not entire other hospitals. Rules for the calculation of pediatric dose, that is also mentioned in the hospital formulary. List of sugar-free drugs, that is also mentioned. List of dialyzable poisons, that is very important, and to avoid the this type of medicine to keep in a same place with a other medicine, so separate place or separate window is required with under lock and key. Now, metric conversion tables also must be there. The conversion of metric conversion means one minim equal to how many ml, or one pint ounce or one fluid ounce equal to how many mls, like that conversion tables also be available. Poison control information or table of drug interaction also be present or included in this formulary. These information must be included in a formulary. Now, preparation of formulary. Visually pleasing, easily readable, and professional in appearance. That is important. And a typical formulary must have following composition: title of page, name and title of members of PTC. PTC members only decided the or form the formulary. So their name must be included in the top of the book or formulary. Table of contain information on the hospital policy and procedure concerning drug product accepted for use at hospital and appendix. These are the things must be present in your hospital formulary. It is published in a once in a year. We can modify within a running year, and we can include the suggestion in next year formulary. Now content, it includes introduction, list of abbreviation, list of drug used in a formulary. Second, the basic information of each drug, like efficacy for the treatment of specific condition, safety profile of the item, interaction profile, adverse effect, pharmacokinetic profile of that particular drug, availability of the item, available dosage form, its cost, and acceptability to the patient. These must be included in formulary. Supplementary information of each drug, like storage guideline, patient counseling information, labeling information, brand name and price. These information also be uh, available or must be available in formulary for particular drug. Prescribing and dispensing guideline, principles of prescription writing, reporting of adverse drug reaction, prevention of adverse drug reaction, that is also included in hospital formulary. General drug use and advice also included in the formulary. Uses of IV drugs, special situation like pregnancy, breastfeeding, liver and kidney disease, that also mentioned in their formulary. Now, poisoning information and antidotes also be uh, mentioned in the literature. Treatment of snake bite and insect bite also be included. Now, miscellaneous section, children dose, renal adjustment, metric unit, diagnostic ads, that we can include in a miscellaneous section. Now, your responsibility or pharmacist responsibility regarding hospital formulary. Drug selection, promoting formulary adherence, that is important. Uh, Medical staff, pharmacists and nursing staff must be, or majority of time they adhere with a hospital formulary. Uh, that is shows the drug which are available in a hospital. Majority of time the that particular medicines we can use or we must use. Review and take action on the non-formulary drugs used in a hospital. If physician is prescribing non-formulary medicine or drugs or brand name or generic drugs, then you note down that particular drug and inform to PTC for the inclusion of that particular drug in a hospital formulary. Provide a copy of hospital formulary to the doctors in a hospital. Doctors must be know about the formulary, hospital formulary. Involve the medical staff in a various formulary implementation program. Uh, these programs, formulary implementation programs is going to held in an entire year or in a month wise to educate the medical staff and nursing staff, pharmacists to adherence of that particular formulary system. Give much advertisement and publicity regarding the formulary. And finally, very important is revision of formulary. If you want to revise your formulary, then you can go to the PTC and work on the revision of that particular formulary and change or inclusion or exclusion of the medicine or items in that particular drugs. Now, what is a formulary? Difference between formulary and drug list. You can see here that is separate table is there. Formulary is listing of drug by their generic name followed by information on strain, form, posology, toxicology, uses and recommended quantity to the dispense. Now, drug list, that is generic name followed by data on strength and form. Similarly, in formulary, it is prepared locally by its own clinical staff, and drug list, it is prepared by countries' outstanding clinicians, pharmacologists, and pharmacists. Now, in formulary, the information provided is subject to local needs and desire. That is particular formulary is particular hospital, just like in Hamidia, some formularies they are using Kasturba Hospital, some another formulary they are using JP Hospital, they are using, but majority of drugs are same, but some they include or exclude as per the specialty of that particular hospital. Similarly, according to their pharmacological properties, drug list we are preparing. So these are the some information regarding the formulary, hospital formulary. Some references you can go for to read more about the hospital formulary. One very important book is Hospital Pharmacy by William E. Hassan, that is available in our library. One copy is there in reference section. You can refer that particular book. Some book which is available in a market, that is a textbook of pharmacy practice by KG Ravi Kumar, Remington, RPS, Remington Pharmaceutical Sciences, that is also available in our library. And one is Merchant Kadri book, that is textbook of hospital pharmacy, is published by Saha and Saha publication. Uh, that is also good book for hospital pharmacy. You can use that also for that particular this particular chapter and other chapter that is already I taught you. So dear student, you go through this. This is a small topics. In yesterday class, we studied drug distribution system in a hospital, and before that, we studied community pharmacy. These small topics are coming in an exam, so be prepared for that. And if you have any query, any question, you can directly ask to me, or you can write in a chat box also, or WhatsApp. You can WhatsApp me also. So be prepared for the examination. And students, they are not registered, please get registered and pay some amount of your fee and get registered in 7th semester. That is important.